So I thought it was probably quite important to make very clear that I am not qualified. I'm not a doctor. I'm not a psychologist. 48 years old, and I've had OCD since I can remember. Wow. Since I can remember anything from 3, 4, 5, around that sort of age. I think it's important to give a good, clear definition of what OCD is, according to the National Health Service, NHS. Briefly described by the NHS, Obsessive Compulsive Disorder OCD is a common mental health condition where a person has obsessive thoughts and compulsive behaviours. OCT is something totally different, probably. OCD can affect men and women and children. Some people start having the symptoms early, often around puberty, but it usually starts during early childhood. Beep! OCD can be distressing and significantly interfere with your life, but treatment can help and keep it under control. So symptoms of obsessive compulsive disorder, OCD. If you have OCD, you'll usually experience frequent obsessive thoughts and compulsive behaviours. So what is an obsession? Well, I've talked a little bit about this. An obsession is an unwanted and unpleasant thought, image or urge that repeatedly enters your mind, causing feelings of anxiety, disgust or unease. It's almost like you don't want to have those feelings, so therefore you get them. It's a little bit like don't press that button, so you do. A compulsion, on the other hand, is the repetitive behaviour or mental act that you feel you need to do to temporarily relieve the unpleasant feelings brought on by the obsessive thought. So, for example, someone with an obsessive fear of being burgled may feel they need to check all the windows and doors are locked several times before they can leave their house. This is something that we often associate OCD primarily with being to do with. Women can sometimes have OCD during pregnancy or after their baby is born. Obsessions may include worrying about harming the baby or not sterilising feeding bottles properly. Compulsions could be things such as repeatedly checking the baby is breathing. I think some of those things would actually be quite normal for anyone to have if you've just had a baby. And people with OCD are often reluctant to seek help because they feel ashamed or embarrassed. Yeah, that definitely. Yeah, for most of my life, definitely felt embarrassed and ashamed. And I'm doing something about it finally. OCD is a health condition like any other, so there's nothing to feel ashamed or embarrassed about. Well, thank you for telling me that. Having OCD does not mean you're mad, and it's not your fault you have it. There are two main ways to get help, and obviously see a doctor, and the other one is see a psychologist, blah, blah, blah. I mean, there's loads more on this website, and you can look it up if you go to the NHS. I think it's worth having a look at the NHS website because it is a site that's wise and has been put together by people who have thought carefully about what it says. There's a lot of sites, a lot of different things you can go on, and you can sometimes get the wrong description for what OCD actually is. And as I've said on other videos, it is very different for every different person. So I'm going to try to skip through a few of these different things just so that I can make it very clear that whilst I'm giving my experience, which is individual to me, it may not apply to anybody else, I'm also putting a foundation down of wise facts that I've gleaned from the NHS themselves. Okay, so thank you. 5 minutes 57. Sorry if Gordon the three-legged cat's been cleaning his bottom, but you know, we all have our needs.